Cooking offers a valuable hands-on learning experience that helps your child to understand things better and pick up essential life skills. They can learn to do something for themselves and others, as well as show others what they can do. This fosters their independence, sense of pride, and self-worth. Autistic children often have sensory challenges that make it difficult for them to touch, smell, or taste certain foods. By helping you with food preparation at home, your child can explore their senses in a safe and calm environment. Your child can help with tasks like washing and cutting fruits, kneading bread, breaking and whisking eggs, mashing potatoes, and others. If your child needs extra help with their fine motor skills, you can use kitchen tasks and cooking techniques to help strengthen the muscles in their hands and fingers, as well as work on their coordination. For example, you can teach them how to spread butter on toast, pour milk into a glass, use a cookie cutter on dough, and much more. Picky eating and problem feeding are common among autistic children. Spending time in the kitchen with you gives your child the opportunity to interact with new food items, which over time can encourage them to sample the foods. Autistic children often like consistency and notice minor imperfections, which can make it difficult for them to deal with making mistakes. Preparing a snack or simple meal together gives your child the opportunity to make mistakes and learn how to deal with them. Most importantly, when a mistake does happen, model the appropriate language and actions for your child. For example, you could say, "That's okay. Let's wipe the spill together," or "Let's try again." Autistic children often struggle with social skills and interacting with others. Cooking together enables you to engage with your child and model socially appropriate behaviors and conversations. Spending time in the kitchen with you or other family members gives your child a chance to work on their social skills, such as teamwork, waiting, turn-taking, sharing, using manners, and following directions. Preparing meals and being hands-on with food can help your child to develop their understanding of nutrition. Reading skills, recipes and instructions, math skills, counting and measuring, problem solving, creativity, understanding of cause and effect, and much more. Before you start teaching or involving your autistic child in cooking, there are a few things to keep in mind. Firstly, take the time to understand your child's interest, level of ability, and manage your expectations. Be aware that cooking involves various sensory inputs, which may be triggering for your child, so be ready to manage sensory challenges. You must also be prepared to show your child how to do something or give directions over and over. Give them time to process what they've just seen or heard. Your child may need to take many small steps over a long period of time in order to succeed. So be sure to give them lots of time to practice, and above all, be patient. Many children who have autism experience great anxiety as mealtime approaches. The underlying reasons can include sensory aversions and fear of unfamiliar foods. Inadvertently, families can make the anxiety worse by trying to force a child to eat. Setting up a pattern of mealtime stress, fear, and anxiety can shut down hunger in a powerful way by putting the child's body in a state of fight or flight. To reverse this pattern, I counsel parents and other caregivers to spend a few minutes helping the child relax before mealtime. One way to do this is to spend 5 minutes practicing deep breathing together. This can be as simple as slowly and deeply inhaling for a count of 4, then slowly and fully exhaling for a count of 7 or 8. Alternatively, the two of you can blow pinwheels, bubbles, or even a wind instrument, such as a recorder or harmonica. Or you might use those 5 minutes doing what we call a deep pressure tactile exercise. I like simple exercises like pushing hands against the wall, lean in with your full weight, or having your child push the palms of his or her hands against yours. I can't overemphasize how important it is for a family to eat together as a matter of routine. Environmental cues help all children, and especially those who have autism, learn what they're supposed to be doing. For example, a child's bed is an environmental cue for sleeping. Similarly, the family table needs to be for eating. In addition, eating together helps your child learn through imitation. Children are wired to copy others. And a child will be more likely to put a new food in his or her mouth after seeing you do so. Often, the first step is to undo habits, such as eating in front of the TV while seated on a parent's lap, while playing with a touchpad, etc. I counsel families to start by having their child sit at the table with them or another family member, even if it's just for 1 minute to start.